Okay, Dr. B here doing one final video on emotional freedom technique. So I did an introduction video and then I did 3 videos which were teaching the the technique as taught by Gary Craig, as I learned it and understood it. So in this video, I'm going to give a little more depth to it. This wasn't taught by Gary Craig. I find it valuable and maybe you will too. So I mentioned that each of these tapping points is an acupuncture point connected to a meridian, and that there seems to be a correlation between specific emotions and these acupuncture points. Okay, and people much smarter than me figured this all out. So, Roger Callahan pioneered the tapping technique. Gary Craig ran with it. Is who I'm going to reference today for the specific emotions with each acupuncture meridian is the work of Scott Walker. So he created a technique called neuroemotional technique, or NET. And I took a few of those seminars. I think they're really good. The only downside is you can't really do it on yourself as well. Whereas the tapping technique's an easy one you can do with yourself. And maybe they've figured out a way to do it on yourself. But so we're gonna apply. Now, Scott Walker was also a member of the International College of Applied Kinesiology, and I'm sure that he knew Roger Callahan well. I'm guessing. But so he also looked into Chinese medicine. All these guys did, because Chinese medicine has a lot to offer. By the way, I practice Western naturopathic techniques. I'm not a big Eastern, like Chinese medicine guy, other than there's just some great techniques and understanding that I've gleaned. I had 200 hours in acupuncture in naturopathic school. Okay, so there's all my history and disclaimers, but so Scott Walker made a chart that has the specific meridians and the most common emotions, and then the ones that aren't as common, which there's just way too many for me to go through here. And if you really want to know, you can take Scott Walker's course. But we're going to start off here. He didn't make these up. He studied Chinese medicine and put together this for the rest of us. These are TBM sequences. So if you're my patient, I do TBM in my practice. And so he applies some TBM here. Okay. So we start off, this point is the bladder point. So on the chart here, this point correlates with, it says paralyzed will. What does that mean? Well, he broke that down for us. He says it means you can't do something that you want to do. So if you're feeling that in your life, you're like, man, I really want to do this thing. I want this job. I want to take this trip, but I just feel like I can't do it. Well, you can use this bladder point. Okay? So to apply this to some extent, you either need this chart or you need my video to refer to, or you have to memorize it. So, or you can write them down as I'm describing them here. Okay, so take your pick. I have tons of material in my phone, just any notes I've taken from the last 15 years that I can easily do a search for and refer to. So there's some options for you. Okay, so that's bladder. Paralyzed will, can't do something I want to do. Right here is gallbladder. This one is for resentment, okay? And so you resent, someone did you dirty, someone did you wrong, okay? You can tap on here, you can think about that situation that you're resenting, okay? That situation or that person. Next, this is stomach. So the emotion that's correlated here, he said, was overly sympathetic. So not just that you're sympathetic, you're overly sympathetic, which is almost like you're taking on someone else's burden. And or like feeling sorry, he said, like feeling too sorry. You're taking it on yourself. Okay. Well, you probably have enough stress. Don't take on other people's stress too much. Okay. I'm all about compassion and loving and helping people. Just don't let it become pathological for yourself. Okay. That's overly sympathetic. Next one. This was governing vessel. And he called this false pride. Like you're not all that. Okay. To give it a little more, I'm going to read a few of these so it's like arrogance, disdain, haughtiness. Okay. So that's kind of a feel for what this point means. Okay. Next one is shame. Now, I'm going to use this to make a point. To some extent, these are normal feelings. There's a time and a place to feel ashamed, okay? We don't want everyone running around naked. You feel shame from that. There's a time and place to be fearful or sympathetic. Okay, so why do we use this technique then? What are we tapping on? It's an uncontrollable feeling. So it's when the shame just completely takes you over and you like can't function. It's all you can think about is your shame. Then you can use this technique to release that heat and emotion. Irrational, uncontrollable. Okay? Tap it away. Okay? So, with all of these, maybe tapping is just the first step, and then maybe you have some actual things that you need to do in your life to fix that problem. Okay. So this is just something you can do to kind of gain some power, control over your emotions so that they're not controlling you. All right. I think I made my point there. Next is kidney. So the kidney point, also known as the collarbone point, that one is fear. Fear is a very common emotion. This is a great point to tap on. Okay? That can be your go-to. You tap there. Or you can just do a single second. Okay. Next is the spleen point. So on either side. And spleen is low self-esteem. I think another good one there is it can be used for anxiety about the future specifically. So that's your point for low self-esteem. Okay. Next is going to be lung, point here on the thumb. And lung is associated with grief. Maybe you've had a loved one pass away. And again, I don't think we don't get loving people without getting grief. But if you're just overwhelmed by grief and you can't get a handle on it, that's when you can tap on. Grief is also good if you feel like you've missed out on life. That's another form of grieving. Like, oh man, I never was as successful as I wanted or did this thing that I wanted to do. That's something you can tap away there. Another kind of grief. Okay, here is the large intestine. Now, the way he describes this is dogmatically positioned, like you're stuck, is the way he said it. Another word he used here was defensive. So too dogmatic. Okay, you're stuck. Next one is going to be the pericardium meridian. In acupuncture, there's other correlations here, and there's a lot of emotions that could be tied in with it. So it's called the pericardium meridian, but also called the circulation sex meridian. So talking about blood circulation and sex hormones. Okay. So again, you can use these either for that specific organ or that function, or you can use it for the specific emotion. And that's why I'm teaching this extra layer for tapping. I think it's important. I think it's applicable. Okay. So which specific organs are tied in with the circulation, sex, or pericardium meridian? As I read it here, my understanding has always been that adrenals on men would be prostate or testes. With women, ovaries or uterus, and then also the pituitary gland. Okay, so those are all tied in with hormones, circulation, sex, pericardium. Okay. Next, so in the tapping sequence, we skip the ring finger. I actually never learned why that meridian is what we use for the 9 gamut point. Sorry. But the next one is heart. Okay. So heart is a strange emotion. It says frightfully overjoyed. So it's kind of the way that the Chinese see it. We don't really think of joy as being, but it's what that's, as I understand it, frightfully overjoyed is just there's like this sudden emotion that just kind of overtakes you. And to give you a little more context, in Chinese medicine, they correlate the heart with a lot of mental problems, mental disorders. Sleep would be one of them. If you're not sleeping well, we kind of think of that like a brain thing, but they would see it as a heart thing. But the biggest correlation I would make with a mental disorder would be mania, manic disorder. So that'd be like the highs of bipolar, and also depression. So the low of depression. I'd correlate both those with the heart, with my understanding of Chinese medicine. I hope there's not like an acupuncturist here who's just tearing his hair out by what I'm saying here, but I think that this is useful, and I'm not claiming to be the expert. This is what I've done for years with myself and my patients, and I think it's really helped. Okay, so again, so heart, frightfully overjoyed, too happy. So some other examples he gave of that would be abnormal or inappropriate laughing, lack of emotion. I said depression, manic, too talkative, like not grounded, I kind of think too. Okay, so that's heart. Give a little extra insight there. Then small intestine, that's the karate chop point. And the emotion that he correlated with that is lost, like you're helpless, okay? Or vulnerable, like you're easy to hurt. You're feeling vulnerable, abandoned, deserted. Okay, I'm throwing in a few extras for you. Insecurity. Okay, so that's the points from the basic sequence. I don't know why liver never got added in. Liver, there was a little controversy on what would be the liver tapping point. So this is gonna be a bonus point for you. There's one here, kind of on the margin of the ribs, and then there's one just right over the ribs. I always just tapped them both. So something to consider. You have all these acupuncture points on your hand, but they're also on your feet. Okay, now they're different acupuncture points, but the benefits you get from tapping here, I really feel like you can get a lot of benefit from walking or running, jogging. So a lot of people will, when they're in their head, they've got all these emotions and everything, they'll go for a walk and they feel better. And I think there's a lot of reasons for that. But part of that is going to be because it's almost like doing a tapping technique. Okay, so let me just make sure we got everything here. I mentioned that this is the spleen point. It's also correlated to some extent with the pancreas. I think we got them all. Okay, so that's a deeper look into the emotional freedom technique. Now, if you want to learn these points and their emotional correlations, I think that's really helpful. I think Gary Craig, he wanted to create something simple that everyone could do without becoming an expert. And so if that's you and you don't really want to memorize those emotions or write them down, he called just doing the whole sequence, he called that the overhaul technique. Okay, so it's like you've got a problem in your car and you don't know where it's at, so you're just going to replace everything or you're going to fix everything. Okay, that's the overhaul technique. And sometimes I'll do the overhaul and sometimes I'll just do specific points. So again, that might come with more experience. Okay, let me know if you guys have any questions. I'd be willing to make another video. Hopefully this helps. I think it's such a great technique. It's so easy to learn. Probably between all my videos, it took you 45 minutes to learn this technique. You can start applying it right away. Okay, so wishing you the best and happy tapping.